The doctor is in, and our topic today is colorectal cancer. Colon cancer is the second deadliest form of cancer here in the United States, but it doesn't have to be. It is preventable, but in its early stages, there often aren't any symptoms. Dr. Scott Ackerman is one of the First Coast's leading oncologists. He is here today to talk about what the symptoms you should be on the lookout for and how the cancer is diagnosed and treated. Dr. Ackerman, thank you for being here as always. So let's start out very simply with what exactly, for people at home who might not know, what is colorectal cancer?
Colorectal cancer is cancer of either the colon or the rectum. And since they behave and they grow in a similar fashion and they're treated similarly, both the colon and the rectum, we kind of group them together as colorectal cancer. And also the risk factors and the prevention and the treatment are very similar, so we group them together as colorectal cancer. These cancers of the colon and the rectum turn out to be the third most frequently diagnosed cancer in men and the third most frequently diagnosed cancer in women. In men, it's behind prostate and lung cancer, and in women, it's behind breast and lung cancer. But because it's in both men and women, it winds up being the second leading cause of cancer death in the United States. And in the colon and the rectum, the cancers begin usually in the lining of the colon and the rectum. It's abnormal cell growth within the lining of either the large colon or the rectum.
So how does the cancer start? How does it begin? Just kind of break that down for us.
Usually these cancers begin as benign polyps within the colon or the rectum. These polyps, they could be either adenomas or they could just be hyperplastic polyps, just tissue within the rectal wall that kind of grows out. And most of these benign polyps remain benign, but some of them have the potential to turn cancerous. So we have found that if we remove these polyps early, we can prevent cancer from growing.
Which is why it's so important to get the screenings, and we'll get to that in just a second. But what are some of the risk factors that are associated with colon cancer?
Well, there's both genetic risk factors and there's lifestyle risk factors. So the genetic risk factors you can't control. And these are things like genetic defects that we have identified that predispose one to getting colorectal cancer. Something called Lynch syndrome we could test for. When we see people with a family history of colorectal cancer, we check them for Lynch syndrome. There's also women with breast or ovarian cancer also have a genetic predisposition to getting colorectal cancer, and you can't do anything about that. Other things you can't do anything about is inflammatory bowel disease. We see colorectal cancer as you get older. Those things, again, they're all related to genetics, and you can't do a whole lot about that. But there are lifestyle factors that you can control that will that can contribute, or if you control them properly, will minimize your risk of developing colorectal cancer. And for instance, things like a diet. We have found that diets high in red meats or in processed meats like salami and hot dogs and all that great stuff I love.
Right, that tastes really good.
It tastes really good, but I have in moderation.
Right.
But those things can put you at higher risk for colorectal cancer. Obesity is related to colorectal cancer. Physical activity, again with obesity. We have found that people with a low fiber diet have a higher incidence of colorectal cancer. So a high fiber diet helps get all the waste out of your body and helps minimize toxins of building up in the colon and the rectum, and that'll help to minimize your risk of colorectal cancer. And we've also seen, not as strong as other cancers, but we've seen a relationship between tobacco use and with alcohol use and colorectal cancer. And
then with screenings, we talk about preventing colon cancer. How early should people start getting screenings? How often should they get screenings? What do you recommend?
You know, screenings in colorectal cancer are very important, and it's really more important than screenings in other cancers, because not only do screenings for colorectal cancer find colon and rectal cancers early. That's why we do screening. Like for breast cancer, we do mammography to identify cancers when they're very early. But screenings for colorectal cancer can also prevent colorectal cancer. A mammogram doesn't prevent breast cancer. It just helps us find it early. But a colonoscopy can prevent colon cancer, because if you have a polyp removed early, it's removed when it's benign and it never becomes cancerous. So the colonoscopy is a painless procedure. A tiny little camera is put inside the colon, and the doctor looks around and sees if there's any polyps or those sort of things. I recommend that people have a colonoscopy beginning at age 50. Just you have to have your first one at age 50, and then if that's clean, if there's nothing seen on that colonoscopy, then you're good for 10 years. If the doctor does see something abnormal, when he or she does a colonoscopy, he or she may want to get the patient back in a little bit more frequently to check them. If you're at high risk of colorectal cancer,
like
because
family history,
that sort of thing, I recommend that you start that screening at maybe a decade earlier, maybe at the age of 40. There's some other methods for colorectal cancer screening that we've looked at. We've done virtual colonoscopies with a CAT scan or barium studies, which is a regular X-ray. These are good, but the colonoscopy is still the gold standard. That's the best method for screening and for early detection and for colorectal cancer prevention.
Okay. Dr. Ackerman, thank you so much for being here. We
Thank you,
appreciate
Casey.
your insight and for sponsoring the segment. Dr. Ackerman is with us every Friday. He will be with us next talking about migraines. For questions regarding today's topic or any other health questions that you might have, you can visit firstcoastoncology.com. Once you get there, confidentially submit your questions to ask the doctor. No matter what they may be, they will respond.